Okay, hello. I wanted to take some time and do an overview of the Defiance County Community Health Improvement Plan, also known as the CHIP. So today I'm just going to do an overview of the 2022 through 2024 CHIP, sort of take a deep dive into what is inside, and then look at the progress that we have so far throughout 2022. So what is the CHIP? Essentially, this is a blueprint for improving health and health-related systems in our county. We're going to talk a little bit more about what is inside and how we got there, but what you'll learn is that the CHIP gives us strategies on how we can look at health outcomes in our county and figure out ways to improve those. So again, how did we get here? So there are many factors that affect a person's health. And our CHIP, what it does is encourages connecting with partner agencies, whether it be behavioral health, mental health agencies, healthcare, transportation, policymakers all across our county, and see how we can work together and come to work towards accomplishing common goals. The CHIP was created through public input. This is from surveys, various meetings that occurred, as well as a review of local and state statistics, national statistics as well. So in this version of the CHIP, we were due to update this after the pandemic had started, and we did not want to necessarily do a bunch of new survey data, knowing that at the time the pandemic, having been new to everyone, could potentially skew some of the survey responses. So in the 2022 through 2024 CHIP is a combination of data that was from our 2018 community health assessment, as well as some secondary data that was gathered from different sources. The purpose again of the CHIP is so that we can try to improve behavioral, physical, mental, and social health and overall well-being of our community. This includes things like safe housing, transportation, our neighborhoods in Defiance County, social injustices such as racism, discrimination, and violence, access to education, job opportunities, and varying income, access to nutritious foods, physical activity opportunities, and then we look at polluted air and water, neighborhood, and literacy skills. So when we look at what makes up a person's health, we have various things. And if we look at our guy here on the left side of your screen, we can see that we have various socioeconomic factors. You may also hear these referred to as social determinants of health. This could include education, a person's job status, family or social support, income, and community safety. And in this model, it shows that approximately 40% of a person's health could be made up of these socioeconomic factors. Next, a person's physical environment. So this could include the neighborhood that they live in or the built environment. Do they have access to safe drinking water, plumbing, public sewer, etc.? This makes up 10% of a person's health. Now, next we look at health behaviors. So these are actions or decisions that are taken by individuals that can affect their health. Things like, do they choose to use tobacco? Are they choosing to eat healthy or regularly exercise? Choosing to drink alcohol or drink alcohol sparingly? And then sexual activity, that could be in relation to communicable diseases. That makes up 30% approximately of a person's health. And lastly, we have healthcare. Traditionally, when a person thinks health, they may think of healthcare or access to healthcare. So this could be visiting your primary care physician, access to dental care, or other health-related systems. And it also looks at, okay, is this healthcare, is this accessible, and what is the quality of that healthcare? So when we look at our community health improvement plan priorities for this cycle, again, 2022 through 2024, we looked at these different things that make up a person's health, along with our community health assessment data and that secondary data that I mentioned. And we said, okay, we want to come up with some priorities that are addressing these things and ultimately can affect a person's health. So for Defiance County, there are 6 priority areas. Those are community conditions, health behaviors, access to care, mental health and addiction, chronic disease, and injury prevention. You can see on the slide here sort of just some general ideas of things that are contained in these priorities. But as we advance through the next slides, we'll go into, again, a deeper dive of these different strategies to improve these different areas. So we'll look at community conditions first. Community conditions fall under, again, these different factors that affect a person's health. So community conditions, as far as socioeconomic factors go, we're looking at things like affordable housing development and preservation, early childhood home visiting programs, so this could be early childhood intervention programs, as well as health and all policies. When we look at health and all policies, this is the idea that any decision that you make, so you could be an agency, it could be a government entity, a private company, any decision that you make considering that those choices ultimately could affect a person's health, and so taking those decisions under advisement and looking at, okay, if we make this decision, is this going to affect a person's health positively or negatively? So health behaviors fall in both under socioeconomic and a person's physical environment. So choices that people make, actions that they take. So we're looking at food insecurity and screening in our county. If a person goes to the doctor, our screen is occurring, asking those patients, okay, do you have access to food at your home? Do you have money to buy foods at your home? Looking at healthy food initiatives and food banks. So are food banks offering healthy options such as fresh produce at those food banks? And then looking at, as far as physical environment goes, complete streets and streetscape design. So again, if we're designing these things, are these sidewalks wide enough that we could fit strollers down the sidewalk or wheelchairs down the sidewalk? Are the sidewalks in good condition to where it makes it easy for people to walk and get physical exercise in their neighborhood? Also regarding health behaviors, looking at mass media campaigns in our county to address things like tobacco use, looking at promoting physical activity in our county, so coming up with some community-wide physical activity campaigns. Our next priority is access to care. One thing that we looked at is making sure that guides for family services and support, that those types of guides are updated. So if a person needs help connecting with some mental health resources or things like that, making sure that that there are guides available to our community to get connected with those services. As far as access to care and physical environment goes, looking at public transportation systems, there are a percentage of people in our county that do not have vehicles. So looking at, okay, are there ways that we can provide some type of public transportation? So if they need to get to a job or need to get to a doctor's appointment or school, that there's an option out there for them. Also addressing things like workforce shortages, dental awareness, and health literacy. So again, these types of things are connected to healthcare specifically, looking at are there shortages in the healthcare field? Is there access to dental care for all people in our county? Many insurances do not cover dental care, so looking at that and expanding upon that to provide dental services for those that do not have insurance or that their insurance would not pay for dental coverage. And then health literacy. So this is just empowering people to understand more things about their own health. What does it mean, to get preventative care or to be screened for things like hypertension or cholesterol or different things. So mental health and addiction is a big priority in the CHIP. It covers a lot of ground, looking at providing youth prevention type services inside of schools, developing a unified approach to that programming, making sure that there are alcohol or other substance use prevention programs that are occurring in schools. Many of these programs are going on in schools in some way, but not necessarily maybe all of our schools that exist in the county. So just working with different agencies to provide those types of programming. As far as mental health goes, again, looking at suicide awareness and education programs in the schools, mass media campaigns that support mental health, community-based mental health education. So this could be things like mental health first aid, which is taught by Maumee Valley Guidance Center. That is available to community members or to businesses and different employers that are interested in bringing that to their employees. And then looking at other types of campaigns which could address risky behaviors or substance use. The next priority is looking at chronic disease. So a leading cause of death is heart disease in our county and really across the country and many parts of the world. So as an early indicator for heart disease, making sure that there are blood pressure screenings that are occurring in adults that are aged 18 and older. So looking at this again from a community-based approach, okay, what gaps are there, and what agencies or partners could help to close those gaps and provide those types of screenings. The last priority is injury prevention. So looking at increasing community awareness and education for risky driving behaviors. So the health department is involved in a Safe Communities grant that focuses on seatbelt use, youthful driving, impaired driving, different things and strategies that are effective in promoting education to reduce lives lost as a result of risky driving behaviors. Also, increasing awareness for child passenger safety. Are families aware of child passenger safety laws, including booster seats and child restraints in car seats, making sure that children are properly restrained. Activity programs for older adults. So this is looking at programs such as A Matter of Balance, empowering community members and residents, that they can resume their daily activities and live their lives, but educating them and helping to promote ways that they can move effectively and safely, reducing the chance that they could have some type of injury. And increasing the use of safe sleep practices. So this is making sure that parents, but also caregivers, so this could be grandparents or babysitters, that they are following evidence-based safe sleep practices for infants and young children. So when we look at the actual percentage that these strategies make up of our overall community health improvement plan, for these socioeconomic, anything that falls into that category, in Defiance County, our strategies actually make up 44% total compared to the model, which is 40%. Looking at physical environment, Defiance County CHIP, again, 8% of these strategies fit into physical environment, according to the 10% in the model. Health behaviors, Defiance County CHIP strategies making up 36% of the total compared to the 30% in the model. And then healthcare, of our strategies there, the healthcare makes up 12% compared to 20% in the model. So it is neat to see that our Power Defiance County work group, looking at data, looking at our county profile, and all things considered, that we came pretty close to this model, which is good. It means that we're using the data effectively. So to sort of sum everything up, I wanted to add this additional slide. This is the Health Impact Pyramid, which is a framework that was created by Tom Frieden, and he was actually the director of the CDC and has done many other things as far as public health goes in the United States. But he came up with this framework. And so when we look at this pyramid, let's look at it from the top down. The further you are at the top, that requires more effort from an individual. So they're having to do, more themselves, potentially. So at the top of the pyramid, we're looking at counseling and education. So this could be one-on-one counseling, peer-to-peer support, or even a physician, to a patient. Could be things like giving individuals brochures for them to read, doing different types of handouts, or even doing education, inside classrooms. So as we move down through the pyramid, there is less effort required from the individual, but there is a higher impact on the overall population health. So just keep that in mind as we go through the pyramid. So our next tier is clinical interventions. So these could be things like HIV treatment, treatment of tuberculosis to decrease the spread, aspirin therapy, and other things like that. So clinical interventions that, not necessarily preventing disease, but maybe preventing the spread of disease or preventing injury by introducing some type of intervention. In the next tier, we have long-lasting protective interventions. So these could be layered prevention strategies, so looking more at primary prevention, things like vaccines, installation of handrails, maybe in a building to prevent falls, treatment of tobacco addiction, so a person is already using tobacco, but now we have a nicotine patch or something like that, and some other types of therapies to reduce that addiction, to try to get them to quit using tobacco products. And the next tier, we're looking at changing the context to make an individual's decision, make that an easy decision and make that the healthy decision. So looking at increasing access to vaccines. So maybe, there's a part in the county where there's no clinics or, physician's offices or anything like that. So maybe doing a pop-up vaccine clinic or something like that there, so that it's easier for that person to go and get a vaccine. The introduction of fluoride into drinking water is a good example of this. Smoke-free workplaces, any workplace that has adopted a smoke-free policy, that will obviously have a healthier outcome for that workplace, but potentially those individuals as well. Looking at safer streets, so again, repaving sidewalks, separating walking sidewalks from the actual road itself, or introducing biking lanes so that it's safer for bicycle or pedestrian traffic, and looking at different types of policy changes such as health and all policies. So in our last tier, looking at socioeconomic factors, again, those social determinants of health. So this could be looking at things like increasing access to education, looking at a person's economic status and how do we improve their economic status, based on maybe the area that they live, by addressing things like workforce shortages, access to services and healthcare, a person's built environment, etc. And so when we look at this bottom tier, we know that if we can address these things, then it requires little impact on that individual, because we're looking at it from a systems-based approach or a community-based approach, looking at making these things better, removing disparities so that there's more equitable access to things. So less effort on the individual, but would have a greater impact on the overall population health, in whatever group we're looking at. So those are just some things that hopefully help to illustrate the Community Health Improvement Plan for Defiance County. I just wanted to sort of give a brief overview, but in the second video, we will look at the CHIP for Defiance County, the progress that we've made so far in 2022, and then look at some action steps that we have moving forward. If you have any questions, feel free to contact me. My contact information is there on the screen. Phone number is 419-784-3818, or you can email me, Brian at bheil@defiancecohealth.org. Thanks.